Thank you for taking the time to watch this educational video for total knee replacement and partial knee replacement. I'm very thankful that you've chosen for me to do your surgery. I'm very appreciative that you put your faith and trust in me and my great staff here at Sports Medicine and Joint Replacement. The video is designed to carry you through the preoperative, intraoperative, and postoperative portions of a knee replacement. There's lots of planning that needs to take place, and I would encourage you, as well as any primary caregivers, which may be your spouse or children or other friends, to watch it as well. And I would encourage you to watch it as many times as necessary, as you will learn when you are in the preoperative or in the hospital phase or in the postoperative phase of care. I think will be very helpful to come back and watch the video to continue to learn. You will be classified as a type 1, 2, or 3 patient. Type 1 patients are very healthy and will be discharged very predictably on Tuesday following Monday surgery. They will have in-home physical therapy starting Wednesday and go through Sunday, and then start outpatient PT on the Monday after surgery. This should be set up prior to surgery. Type 2 patients have some medical conditions and are our most common type of patient. They will have in-home physical therapy for a week and a half, and that would be Wednesday through the following Saturday. And then we'll begin their outpatient PT on the Monday 2 weeks after the surgery. Type 3 patients have no home support, spouse, family, friends, etc., and will go to a skilled nursing facility. We prefer a brief 1-week stay, but it may be 2 weeks, and then you will start your outpatient physical therapy at 2 weeks after surgery. You will have a pre-op history and physical exam by my physician assistant, Maurice Jones, on the Friday, 10 days prior to surgery. This is mandated by insurance and serves as a time of education and getting all the paperwork in order for surgery. It is a good time to ask as many questions as possible, and would also be helpful to bring your primary caregiver that will assist you following surgery. You will need to have blood work and anesthesia consults 10 days prior or more before surgery. When possible, we will schedule that on the same day as the pre-op history and physical exam with Maurice. This is standard blood work, a chest x-ray, and an EKG. A few days prior to surgery, a company called TNT Technologies will call you and bring a CPM machine to your home. That stands for Continuous Passive Motion. And they'll teach you how to use it. You will be in a CPM machine for 6 to 8 hours a day in 2-hour increments, while both in the hospital and at home for 2 weeks following surgery. This device will quickly aid you in the ability to regain motion and be able to bend your knee. It is also good to figure out prior to surgery where you'll sleep when you return home. Oftentimes, patients will set up a bed downstairs. Additionally, it is wise to remove any carpet you might trip on, and we advise many patients to make any arrangements that will help you after you return home from the hospital, such as grocery shopping, laundry, and getting computers, books, and other items arranged for easy access. Your surgery will be on Monday morning at either 7:30, 8:45, 10 o'clock, or 11:15 a.m. The hospital will want you to arrive 2 hours prior to surgery to get you ready. I will come see you in the preoperative holding area and answer any last-minute questions, as well as signing your leg and signing your consent form. The anesthesiologist will do a block on your leg to make it numb for surgery, which helps significantly with postoperative pain. You will then head back to the operating room, where you will be prepared for surgery by the nursing staff and my physician assistant, Maurice Jones. Your family will be taken to a waiting area. I will speak with them as soon as I finish. The surgery takes approximately 1 hour and 15 minutes. You will be gotten out of bed and into a chair, and also take a few steps around the room on the night of surgery. It is very helpful in getting you moving and to orient you to the equipment you will be using, such as a walker, bedside commode if necessary, and the CPM machine. Your leg will either be in the CPM machine for 2-hour shifts, or in a bone foam pillow, which we call the 0-degree knee, which will work on getting the leg perfectly straight, again for 2-hour shifts. The key to success is constantly working on bending, which we call flexion, and straightening, which we call extension. You will do 3 2-hour shifts for a total of 6 hours a day for 2 weeks in the CPM. You will do the same thing with the bone foam. Of course, in order to do that, we have to do a great job managing your pain, since working on gaining full extension and flexion in these devices can be uncomfortable at times. Pain management is achieved by a number of measures, including the preoperative block, intraoperative numbing medicine placed in your knee at the time of surgery, and postoperative pain medicines. It is critical to communicate with the nursing staff and with Maurice to stay ahead of the pain. Maurice and I will come around on rounds at about 7:15 on Tuesday morning. We will assess your knee and make any adjustments to the pain medication or act on any other concerns or needs that you have. You will have physical therapy after breakfast and again after lunch on Tuesday. If all goes well and your pain is under control, you will be discharged around 5 p.m. Tuesday afternoon. Maurice will come over to see you after we finish in the office and get you ready to go. He will give you pain prescriptions as well as a prescription for Lovenox, which is the blood thinner that we use to prevent clots. Prior to discharge, the nursing staff will teach you how to administer the Lovenox. It is a very small shot into the stomach area, similar to a diabetic giving an insulin shot. It works very well and patients do great after the apprehension of the first shot. The prescription comes with a sharps container to dispose of the needles. You will need a shot on the day of surgery and then for 13 days following that for a total of 14 days. You can dispose of the sharps container or you can bring it into my office. If you are going to a skilled nursing facility, you may end up staying an additional day in the hospital. Again, we do not recommend going to a skilled nursing facility as there is an increased risk of complications such as infection. Home is certainly the preferable option. If, however, a skilled nursing facility is necessary, we only work with a couple of facilities to make sure that your care is consistent and communication with us is good. Once you are discharged, which again would usually be on Tuesday at 5 p.m. or in some cases on Wednesday, a home health physical therapist will come to your home starting the day after discharge. They will come each day except Sunday until you are ready for outpatient physical therapy. We try to get people into outpatient PT as soon as possible. You will start outpatient physical therapy at 1 to 2 weeks out from your surgery. We will attempt to schedule those appointments prior to surgery so there is no delay in getting you started. We only use therapists who are very familiar with how we like therapy to be done, so you'll be very well taken care of. Please let us know if you have any trouble making those appointments, as we do not want any delay or gaps in your postoperative course. Maurice and I will see you back 2 weeks after surgery. At this appointment, we usually get x-rays of your knee, check your wound, remove your staples, refill pain medication prescriptions, and go over physical therapy progress notes with you. Please make sure you bring a progress note from your therapist. They can fax it if they want, but we definitely want you to hand deliver a copy to us as well. If you have any questions prior to surgery or after surgery, please call our office at 336-333-6443 during business hours, which are 8:30 a.m. to 4:30 p.m. Monday through Friday. After hours, there is a doctor on call you can speak with, but we would prefer to talk with you ourselves. No question is a dumb question. Our goal is for you to be completely educated and completely comfortable with the entire process. We are happy for you to come in to be checked any day of the week after surgery, in addition to your regularly scheduled appointments if you feel the need. We do not want you to go to an emergency room unless it is an emergency and you have talked with us. Emergencies are very rare and most issues can be resolved with a phone call or a visit to our office. I have an exceptional staff. You will get to know each one of them by name, and I encourage you to ask as many of them as many questions as you have at any time. And I encourage you to get to know them by name, as they are wonderful people as well as wonderful healthcare professionals. Madison and Kim are my front office workers. They are usually the ones checking you in for appointments, answering the phones, and doing many other business functions for me. Carrie is my athletic trainer and surgery scheduler. She also helps us in the office seeing patients, taking staples out, scheduling physical therapy, MRI scans, surgery, and many other things. Sophia is my x-ray technician. And in addition to taking your x-rays, she too helps with us in the office with taking staples out, scheduling physical therapy, and many, many other things. Lisa is my case manager. She is the one that will organize your postoperative care with regards to a skilled nursing facility, home health physical therapy, and outpatient physical therapy. She will be calling you the day after the discharge to make sure everything is going well, and probably also call at different times to check on your progress. And Maurice is my physician assistant. He helps me in surgery, rounding in the hospital, and does most of the prescribing of the medications. He is with me in the office as well as in surgery. Again, I have an exceptional staff who helps me offer exceptional care to our patients. And finally, Donna is my practice manager. While you may not meet her in the flow of your appointment, please know she is always available to answer questions or address any problems or concerns. We want to do an excellent job of taking care of you. So she would love to hear both the positive and the negative feedback. Our customer satisfaction is over 95% excellent, and we know that the only way that we can continue to do that is by listening to you. So don't hesitate to ask to speak with Donna. Thank you for allowing sports medicine and joint replacement to care for you as you have your total knee replacement. We are committed to making this a great experience for you. We encourage you to watch this video before surgery, in the hospital, and several times when you get home to remind yourself of the different elements and phases of your care. And once again, if you have any questions, please let us know. Thank you.